Hello, my name is Dr. Vikki Petersen, and I practice root cause medicine. Something that people have asked me many times, how did that all get created? And a little bit is about my story. So root cause medicine is kind of the way it sounds, which is getting to the underlying root cause of why a body is malfunctioning. And it kind of all began with my having a body that didn't function very well. I developed migraines when I was a teenager, and I also passed out very often from low blood sugar as a teenager as well. And both those problems my mother had. And so I was told it was genetic and there was really nothing I could do about it. I was given medications for the migraines and was basically told to eat more often to avoid the low blood sugar fainting spells that I had. I craved sugar intensely. I had a lot of fatigue. I was a figure skater and ballerina. As a child, I would practice with. I grew up in New York, and I was near, in Manhattan, very near where a lot of professional dancers did classes, and I was asked or invited to attend a class that professionals went to, and it was a great honor. And my teacher, got me invited, and I remember very distinctly arriving, dancing, and I never remembered the end of the class because I literally passed out before the end of it. And it's so funny thinking back, because as a child, it's like, oh, okay, now as a mother, I think, what was happening there where your child just passed out and you let them be carried out at the end of every class. But, we all have our existence and our life and how our body works, and this is what mine did, and it kind of became accepted in a weird way because my mother was that way. And I remember really at a young age, probably age 12 to 14, deciding I wanted to be a doctor. I wanted to be a pediatrician. I loved children and I wanted to help them. And I was pre-med through college. I was a molecular biology major. I worked in hospitals in the summer. And one summer I wanted to really experience what it was like to be on call all weekend. So I shadowed a doctor, a young intern who was getting ready to graduate, and I shadowed him the entire weekend. And basically the epiphany happened when a gentleman who was basically dying of heart disease in the middle of the night, he was having trouble breathing. It was very severe. And the doctor gave him a very strong diuretic, and that helped. And the next morning he was alive. And this particular intern was happy because nobody died on his shift, which of course is one of the goals. And I remember his euphoria kind of rubbing off on me with, we gave each other high fives. Yay, this guy was still alive. And then for me, the euphoria went to a low because I was struck by the fact that this gentleman was never going to leave the hospital. He was that ill. And just a little voice said, I wonder what would have happened if you had gotten him 5 years ago or 10 years ago, or what could you have done to really reverse this? Because very often the people I was seeing in the hospital were dying of diabetes and dying of cancer, and many people were critical and end stage, and I just wondered what would happen. So I started asking this question, and the answers I was getting was not aligning with something was happening in my personal life, which was that I started improving nutrition because my mother took us to a nutritionist, and I stopped passing out from low blood sugar, which was definitely an improvement. And so I was trying to resolve these two things with being told by doctors in the hospital that, if you want expensive urine, take vitamins, basically meaning they're a complete waste of time. Now, granted, this is going back several decades. We know a little bit better now. And the fact that I was taking those very vitamins and I was doing so much better. I was changing my nutrition, I was changing my diet. So this kind of spawned that idea of what could you do? How reversible would things be if you caught somebody sooner? Fast forward, I got injured. I injured my low back. Somebody took me to see a chiropractor. I had no idea what chiropractic did. This particular doctor also did a lot of nutrition. He figured out I just had mono. I had developed mono in college, and he figured that out even though I didn't tell him I had it, just from checking various things in my body. And I was very impressed with this. Not only was he helping my chronic low back pain that I had had my whole life, but he figured out that I had recently had mono. He didn't know what was going on, but he saw some imbalances, and I thought that's pretty interesting. So, and that was the other thing. So these were the things that came together, and then my husband and I created what we call root cause medicine, which is just focusing on getting to that underlying root cause, knowing there is one. Now, I'm not saying people can't get to a stage in their health and in their life where things are so debilitated that drugs and palliative measures are the only thing left to them. That does occur. But for the majority of us, we can take measures to really get to that root cause. And there is a reason the body's expressing the symptoms that it's expressing. For me and my mother, getting back to our migraines and our passing out from low blood sugar, we were gluten sensitive. So of course, if you know me, I speak a lot about gluten because it was an underlying root cause, not just for me, but for many, many, many patients that we see. But looking at diet, looking at nutrition, and taking apart the puzzle that is that person to get to the reason why, how they got to where they are, and what we can do to unburden their body enough that it can heal itself. That's what we do, and it really is the foundation, and it's a great puzzle, and it's interesting to solve for each person because they get where they get to via a different path, but the basics are there. The foundation of the body can heal. It will heal on its own if you unburden it sufficiently. You have to look for what those burdens are. Very often there is a lifestyle-diet relationship, not exclusively, but it's usually a component. And if you look at those basics, you can go a very, very long way. So I bring you this story because I want you to know what root cause medicine is. I want you to know it's available. I want you to know that it's the best way to think about things in order to really get to a new level of health rather than just medicate and then feel the side effects of a medication, and then sometimes you need another medication. That's sort of a dwindling spiral of health versus this is an uplifting spiral of health. So I hope that was helpful, and please write to me, ask the wonderful questions that you ask. I'm here for you. And until next time, I wish you very good health.